On November 19, 2022, at the Radisson Blu Hotel Ikeja, the DFC held its maiden convention and meet and greet event to highlight the group's contributions to healthcare and medical practice in Nigeria. The DFC works to increase access to care and improve the health of all Nigerians through research, education, collaboration, and advocacy. Dr. Douglas Emeka Okor, consultant neurosurgeon, Federal Medical Center, Jabi.
So, is it my turn? Okay. If you all don't mind, I'll rather stand up. Thank you very much. Contemporary Nigeria. We're on the verge, on the precipice, basically on the cliff. We are dealing with main issues: security, the economy, lots of debt, education, infrastructure, power. But guess what? Healthcare is also important. Good morning, ladies and gentlemen. Next slide. I crave your indulgence and rest on all existing protocols. That's me. I'm Douglas Emeka Okor. I'm a brain surgeon trained in the UK, and I've been back in Nigeria for the last 6 years now. And I'm also very passionate about reforms in healthcare in Nigeria. Next slide. Okay, that's just us doing magic in Abuja. Next slide. So, this group, formidable block within the critical mass that is needed to reform and redefine the Nigerian healthcare ecosystem. DFC, Doctors for Change. The time to act is now. Next slide. Okay, so a couple of questions there about who, what, when, and how. Next slide. Okay, so this represents something. You know the 3 A's, components of healthcare: availability, affordability, and accessibility. DFC, fantastic. We've done a fantastic job when it comes to the first A of availability, especially for complex care, isn't it? But when you look at availability and affordability, we are still struggling. Okay, but this represents, basically represents fantastic job of what we have done in terms of as individuals, as groups, as organizations. Next slide. Okay, so it's campaign season. Thank you for that, Dr. Yuri. It's campaign season, isn't it? Okay, what kind of reforms do we want to see? Thank you very much, sir. You talked about primary health care. Here, most of the things that we're doing here, that are the top things, isn't it? Complex care, doing brain surgeries, spine surgeries. We're talking about how can we actually prevent some of these things from getting there. DFC, Doctors for Change, I'm sure you're very interested in Nigeria, at least in the next 4 or 5 years, having some semblance of some sense of primary health care. If you are, say, yeah. Fantastic. Of course, human resource for health. Professor Bayemi has been talking about all the structures that you want to actually get on board. Good, fantastic. But guess what? When you look at all the components of healthcare, the human resource, the human capital, the human means are more important. We would like governments at all levels in Nigeria to actually focus on the human beings. If you're with me on that again, say yeah. Yes, we are all together. Of course, financing. I'm sure someone's going to be talking about, couple of people are going to be talking about financing. How can finance healthcare? But look at that. 100 million vulnerable people, very poor people. We are doing a fantastic job at DFC level in terms of providing that top level care. How many of these 100 people can actually access your services? So there's work to be done. Next slide. Of course, reversing medical tourism. Next slide. Okay, so we are in political season. I'm just going to show some snapshots of some of the political parties going forward. That's the Labour Party. There are a few things on the agenda there. I can't say anything directly on healthcare, but maybe it's hidden somewhere in human capital development. I'm not their spokesperson. Next slide. Of course, that's the PDP. They talk a lot there. Okay, I can see education, which is really good, but not about healthcare. I'm sure it's in your manifesto, but I'm saying on face value, nothing about healthcare. Next slide, please. Of course, and that's the APC. That's your party, Professor Boye. Okay, yeah. Lots of nice stuff there. Education, very good. Oh, no healthcare, but I'm sure it's in the manifesto, lots of it. The key thing is that something that you're really, really interested in, something that you're passionate about, you talk about it a lot, isn't it? How many of you actually hear any of the presidential candidates, governors actually talking about healthcare, mainstream healthcare? I've said all the other issues, they are important, but guess what? Healthcare is extremely important as well. And we wonder, why are we not talking about healthcare? You cannot, in the UK, have some voting and stuff, and they're not talking about education, campaigns, and they're talking about healthcare, sorry. You cannot, it's not possible. Is it possible? No, nah. Next slide. So, what's the strength of the DFC, the diaspora muscle? What's your strength? We've been talking about it since. We've been talking about it. We have the capacity to reverse medical tourism, not just reversing it, but from the central part of Africa and the West African sub-region, actually getting people to actually come into Nigeria. We have that capacity. And Professor Abayemi just talked about making Lagos, for example, a hub. We have that capacity. Okay? When it comes to the issue of patient safety, of quality improvement, and pushing that paradigm of patient-centered care, it is the DFC and people like the DFC, people like us, that can actually push that. Human resource for health again. Human resource for health, human resource for health. We need to start really focusing on building the human beings. Yes, structures and building things are good. In fact, for any government to think that they're just building things and commissioning things that automatically are providing healthcare, that's a lie from the pit of hell. The human beings are extremely important. And of course, investment in the healthcare space, just looking at that previous slide, you can see doctors, all the key players. That's massive investment, isn't it? And of course, influencing governance. Thank God that Professor Abayemi is here. Okay? We have the capacity to influence governance. We need to actually throw our heart there and actually keep putting pressure on these people. Healthcare is extremely important. And of course, trying to shape the policy environment for healthcare as well. Next slide. Next slide, thank you. Okay, so, one of these I always say is that fantastic. Some people say sometimes that, when you get government involved, it's tricky, the bureaucracy, the red tapes and all that. Okay? If you truly want to actually give healthcare and get healthcare to that last man at that end of Nigeria, okay, you need government. Professor Abayemi, we need you. Okay? You cannot do without them. That is the truth. Remember those 100 million vulnerable people? If you truly want to provide care for them, you cannot do it without government. Okay? And I've just said that we're not going to get this support by just chilling in our corners. We ain't going to get the support. That's why big up to Dr. Oyeshola and the DFC and all of us and what we're doing. This is the beginning. This convention, so give you all yourselves a round of applause, please. Next slide. Okay, I just teased this out from, thank you very much to Orede Doherty. This was 2 days ago, and this was when we were chatting on the group. And a few things in these her statements here. Conversation about the public sector. Most of the key players here in the private sector, isn't it, that we've talked about. Thank you, 2 minutes more. We talked about actually pulling the public sector and the private sector together to actually work together. Of course, we're talking about populations in non-profit, also the public sector, integrating social and medical services. And our change, doctors for change. Success to significance and scaling our success. Truly, when you're really making an impact is when you're actually getting to those 100 million vulnerable people. But we must start from somewhere. Next slide. I think I'm rounding up now. Again, so back to the question again. Who are we? What do we represent? What do we have to offer? When should we act? We should act now. And this is great. This is part of the action. Okay? And how do we act? We've talked about that. We're going to talk about that a lot today. Next slide. And basically, this just gives an idea again of what DFC can bring, what we can bring to the fore. Doing top-end things like this, complex brain surgeries, clipping aneurysms, complex spinal surgeries, complex brain tumors. And these things are being done in Nigeria with good outcomes. And we need to keep pushing and pushing. Next slide, please. Because, ladies and gentlemen, the Nigerian patients are worth it. Thank you, DFC, and God bless you all.